Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello everybody, I'm here again today with Recovery Mum, Sharina, and we'll be covering today borderline personality disorder and comorbidity. And what that means is when borderline personality disorder co-occurs or occurs at the same time as one or more other mental disorders. So we'll just get started, we'll get right into the questions, and the first comment here is really just asking about borderline and coexisting disorders in general. So Sharina, your thoughts on this?
The thing is, there are a few comorbid disorders that keep popping up again and again and again with BPD. In fact, I think BPD is one of the highest, like a mental illness with the highest rate of comorbidity. So for me personally, I suffered with borderline personality disorder, and I was also diagnosed with depression or depressive disorder and anxiety as well. I also suffered for years with bulimia, which is an eating disorder, and addiction to drugs. So they're all those four. So what did I say? Depression, anxiety, eating disorder, and addiction. They're really common. I see that a lot. For me, I sometimes question actually if they are separate disorders or part of the borderline personality disorder. So obviously when you get diagnosed with BPD, none of those are any of the traits. I know there's impulsivity, which could be the addiction. Chronic feelings of emptiness could be depression, but they are not actually part of BPD. But for me, I really do believe they were for this reason. So when I got into recovery from addiction, I was being treated 12 steps way, and with the 12 steps of Alcoholics Anonymous, you learn like what kind of addict you are, and how to, a solution to your problem, basically, how to recover from that. And I did everything by the book. I went to all the meetings, I did all the stuff, and it helped, but it did not cure my addiction. When I got into recovery from the BPD, all those other things disappeared. The anxiety, the depression, the eating disorder, and the addiction. And so previously I'd had help trying to overcome the eating disorder. Nothing ever worked. But when I got into recovery from BPD, it stopped. So for me, I would say it was part of rather than comorbid with. But obviously everyone's different, and I can't say that's the same for everyone, because I have seen people with BPD that do 12-step meetings and they find that really, really helps. But yeah, that's my personal opinion on it.
Excellent. Yeah, some great points. You know, I think borderline and comorbidity is so interesting because it's one of these disorders, as you mentioned, is highly comorbid with other disorders. So to talk about it in isolation, you're really talking about just a small number of the presentations, because most people with borderline will have some other comorbid illness. I've seen substance use disorder a lot, and of course the major mood disorders you talked about, major depressive disorder, bipolar disorder. We certainly see anxiety. Sometimes we'll see eating disorders, like you mentioned, also somatic symptom disorder. We'll see sometimes conversion disorder. And then, of course, in the cluster B personality disorders, it's not unusual for somebody to also have narcissistic or histrionic personality disorder, sometimes antisocial. So, yeah, the question really becomes, which one do you prioritize with all these disorders coming at the same time? It can be confusing because you think, well, if I can get through the symptoms of this, maybe the other ones will resolve, or maybe they're completely separate and I just have to go through one by one. And you never really know. And you know, there, I think that's really just where working with a counselor is really helpful to help untangle potential causality and a treatment protocol that makes sense. But there's rarely a really clear answer for what to target first. So it sounds like in your experience, you you kind of figured out what targeting, like what to
Yeah,
target first. Yeah.
it was really trial and error. One thing I would say, though, is obviously with BPD, there is no medicine that helps with it. But for anxiety, for depression, there is. So for me, I kind of had to treat those symptoms with the medicine, learn skills for the BPD, and together I got into recovery. So I focused on the BPD, like learning the skills and doing work on that, doing DBT. But medicine-wise, it was really important for me because my anxiety was so bad I couldn't leave the house. My depression was so bad I didn't want to get out of bed. I could stay in bed for weeks if I could. And so by having medication for that and easing those things, I was then able to focus on recovery for BPD.
Yeah, I think probably one of the biggest debates I see with borderline or really any of the personality disorders is with substance use disorder and what to target first there. Because some people will say, well, you have to get clean of the substances to work on the personality disorder. And other people say, no, the substance use is a symptom of that disorder. So, it's confusing. And I'm glad you kind of found a way where you were able to work through it.
I struggled for a long time because I was doing something called a STEPS program. It's not the 12 steps. It was actually for BPD. It's STEPPS, and it's systematic training for emotional predictability and problem solving. And it was really good, but I was still drinking and using while I was going along. And it got to the point, they said, there's no point you being here because you're not going to be taking it in, the information. So it was hard. And I did go to rehab and I got clean. And that definitely helped. But getting clean is one thing, staying clean is another. And so you've really got to, if you can even just get those first few days clean, then throw yourself into the BPD recovery. That's what I would recommend doing. Because you can't, unfortunately, it's really awkward, isn't it? Because like you said, if you're using, you're not going to be able to take the thing in, but at the same time, the BPD causes us such pain emotionally, then we use. And that's the thing. For me, using drugs was my solution to the BPD. I suffered with unstable relationships. I felt like I was just in a living hell. I didn't want to be here. I hated who I was. I'd take drugs. I'd feel a bit better. So it was my solution to the BPD, even though it's a really, really bad solution because it caused me all other problems. That's why I did it. So for me, I had to sort out the BPD. And to do that, I had to find a new solution. I couldn't just put the drugs down, because if I had just put the drugs down, the BPD would have been out of control, because then I had no solution. So I had to find something to replace that, something healthy to replace that.
Right. So like in a sense, the substances are a coping mechanism, and they may not be ideal, but temporarily they can alleviate symptoms, and then of course the addiction takes hold, and now you have all kinds of additional problems.
Absolutely.
So speaking of addictions, the next question is related to addiction as well, although a little bit different angle. This question asks about borderline and difficulties associated with addictions, including alcohol, but also love addiction. So what are your thoughts there?
Well, I think that's quite a huge one for those of us with BPD, because we jump into relationships. Now, I know not every single person with BPD is the same, but a lot of us, we can jump into relationships, and it's almost like we crave being loved. We want someone to love us and look after us. And I don't know if that kind of stems from childhood or what it, but we want someone there. And like, I used to think every one of my relationships was out of a romantic movie, and that's not life. But in my head, I think, oh my God, I love him. He's so amazing. He's so wonderful. And actually, a lot of the times, the guy might have been really narcissistic, actually. But I'd see him as this big, powerful man come to save me because my perception was way off. And another thing with love addiction is it's a form of addiction. It makes us feel good. We get that high from it. But it's almost like, it's not healthy, it's like an obsession, and it can cause us to behave in ways that we wouldn't usually behave. And for me, it never ended well. It always kind of came crashing down. In the beginning, it's that black and white thinking. I really see them as they're up there on a pedestal. I'm in love with them. They're amazing. But eventually that would switch and they would come crashing down, as would my mood.
Yeah, it's interesting the parallels between substance use and borderline and the love addiction, in the sense of when people are using substances, they also idealize the substance, but then can go to hate the substance, like we see with the idealization, devaluation of people. Yeah. So it's the same application except toward a substance. And I think with the romantic component, obviously, just like with substances, it has an effect on other relationships, right? So having kind of an obsession with one person can affect other relationships and other areas of your life. So it's pervasive, just like substances. So it does have a lot of parallels to kind of classic substance use disorder, what we think of, which involves like a chemical, as opposed to a relational addiction, a romantic addiction.
And a lot of the time, just like the drugs are bad for us, a lot of the time we choose relationships that are bad for us. Looking back, I have a good kind of relationship with my dad now, and I did growing up, but he was an alcoholic, and I found, like, the way he was personality wise, I chose men that were very similar. It was almost like I was trying to replace that father figure. I always went out with men a lot older than me. And it wasn't until recently that I was like, wow, that's what I've done my whole life, is actually try to find that father figure. But I mean, I don't want to say too much because I don't like, I get on well with my dad. But I mean, he was not a good partner, basically, to my mum. It was not good. And I think I grew up seeing his behaviour, and I must have just assumed that's how men should be. And it's only now I'm in recovery that I'm like, wow, no, that's not. You don't do that when you're in a relationship. Like, you don't go having affairs. So just like the drugs, basically, was what I was saying. Just like the drugs are bad, a lot of the relationships, when it is that addiction, our perception's way off, and we just go with it.
Yeah, which counters, I think, the thinking of the time. That the frame of mind that people have at the time is the relationship will save me. So I'll find a good person, and that person will compensate for my pain, my suffering, my weaknesses, whatever. And just like the drug, they don't. There's a selection bias to choosing incompatible partners, right? That seems to be, epidemic when you look at borderline personality disorder. Every now and then I have seen an exception. I've seen somebody choose kind of what I would normally think of as a good partner, and then sometimes there can be a little bit of that effect, but it's a tough road. It's a strained relationship either way.
Yeah, like I did a video once actually on like BPD and relationships, and I talked about how a lot of people with BPD get in a relationship with someone who's bad with them. But then I got thought about it a bit, and I thought actually there's a lot of people with BPD with a really supportive, loving, kind partner, and that poor partner is just getting abused by their BPD loved one. And so then I did another video on loving partners of people with BPD. So definitely it's not always saying, oh, all the partners are bad, but when it comes to that kind of love addiction obsession, I think that tends more to be when we're choosing someone, our perception's way off, and we don't choose someone that's necessarily good for us. Not that we're good for them. We have BPD.
All right, so the next comorbidity question is fairly straightforward, but I've heard this question many, many times. And this is asking to discuss the relationship between narcissistic and borderline personality disorders. So both cluster B, they have some similarities, but what are your thoughts here?
Okay, so I mean, I might be wrong, but I often hear from people that hate people with BPD. They say they are the most evil people, they didn't care, they had no empathy. And for me, when they say that, I really do think, well, the person that you must have dealt with, yes, they might have had BPD, but from what you're saying, there were narcissistic traits there. They were comorbid, because I don't believe people that just have BPD are outright evil. I don't believe they have no empathy. I believe we're actually very empathetic. But when you see, those colder, like nastier traits coming in, that's when I kind of think the two are overlapping a bit.
Yeah, it's interesting. I'm glad you brought up the topic that some people look at people that suffer a borderline and call them evil. Because I was thinking about this for another video, because I get this question a lot about narcissism, right? Like, are narcissists evil? So I was kind of going through and thinking about how this is really kind of, it's mixing philosophy with science, right? Because evil is a construct of philosophy, right? Good and evil. And I'm a big fan of philosophy and theology, and I think they're central to our lives. But science is a separate thing. And I think sometimes what's happening is people are confusing kind of morality and good and evil with what we understand about the characteristics of a disorder from a treatment perspective. So they'll say things like narcissists are evil, or people with borderline personality disorder are evil. But for a clinician, that really doesn't mean anything, right? Because
it's not a trait.
Yeah, it's a disorder that I treat. It's not a judgment that I make. And I think too that, sure, there's good and evil in the world, but I don't really see any alignment between those constructs and mental disorders, right? They're independent, statistically independent constructs, right? But that seems to me to be probably more or of somebody's been hurt, right? I mean, I think when somebody lashes out like that, and I understand why they say it, when they say, narcissists are evil, or people with cluster Bs are evil, that's probably coming from a real deep place of hurt. If somebody hurts you, it sometimes makes it easier to look at that person and say, well, they're evil. Yeah. Right. And that, that might relieve some of the pain. Like it explains it. But to me, that's not a satisfying explanation. There's much more to it. I don't think evil really plays a part in it. It's a set of characteristics, and they all have an origin that we can eventually understand. We don't understand it perfectly yet, but we know that people don't ask to have borderline. They don't ask to have narcissism, right? So in terms of the comorbidity, though, to kind of answer this question, I kind of went off on a philosophical tangent there.
I like that's good.
I see a bit of overlap here, but it's interesting because narcissism is a disorder of, I think the core of narcissism is self-deception. I've said that before. That's kind of my theory behind it. And you could also argue self-centeredness. And somebody with borderline personality disorder could have that to a degree. I mean, they're worried about relationships because they're worried about themselves. Their fear of abandonment is a fear for their own sake, not for somebody else's sake.
Yeah.
But they don't really have the grandiosity, don't necessarily have the envy, the lack of empathy you mentioned. I mean, a lot of times people with borderline personality disorder are empathetic, like you indicated. Narcissism has some overlap, I suppose, with anger. There's something there. And I think probably the other area of overlap would be, and you touched on this earlier, is the fantasy. With narcissism, there's a fantasy of exaggerated wealth and power and success. And I think with borderline, and you hit the nail on the head here, it's a fantasy of an ideal relationship.
Yeah.
Right? Which can be just as intoxicating as believing that you're going to be famous and wealthy and all that.
Yeah.
So, yeah, interesting, very interesting overlap. Whenever you see two personality disorders in the same cluster, of course, there are going to be some similarities between those disorders. So the next question here is kind of looking a little different direction. It's asking about borderline and psychotic disorders. So what do we see in terms of overlap there?
Well, I get asked this a lot from subscribers saying, I'm hearing voices, I'm having psychotic episodes, is it part of the BPD? And I would always say no, it's definitely not. That's not to say it can't be comorbid with it. I only ever suffered once with like really bad, it was a psychotic episodes I kept having immediately after having my first child. But I believe that was to do with like the postnatal or postpartum, I believe you call it, postpartum depression. And I was put on antipsychotics and that eased those symptoms. The thing is, one of the traits of BPD is the dissociation and being out of touch with reality. And I think some people can confuse that with actual psychosis, even though they are different. But yeah, I don't know enough about psychosis myself to know, to really comment. But I would say it's not part of the BPD.
Yeah, I agree. It's not one of the symptoms. There's some comorbidity between borderline personality disorder and some disorders that could have a psychotic component like depression or bipolar. And I think that's what we see probably the most. I don't really see any particular comorbidity between borderline and schizophrenia or something like that, or schizoaffective. But I do see comorbidity between major mood disorders, and at the extremes of depression and mania, there can be psychosis. And I think that's where people get confused. Bipolar.
And drugs.
What's that?
Drugs, drug-induced psychosis.
Also, yeah, substances can certainly lead to psychosis. Which can make the diagnostic profile confusing to clinicians. But with borderline personality disorder, it can be comorbid with bipolar. And a lot of times people think you have to have one or the other, but it can be. And I think that's a point that gets confused. And I agree, in terms of the dissociative element that we see and the paranoia, both of those seem like psychosis, right? They're moving right at the border of psychosis. And if you take that and you put on affective instability and you put on the anger that doesn't seem rational, I can see where a clinician can be confused and say there must be some sort of reality testing and there must be some sort of psychosis. And but a lot of times there's not. I mean, borderline is highly comorbid with a lot of disorders, of course, but I don't see a tremendous amount of psychosis being comorbid. Yeah.
I'm personally, I was given antipsychotics to take though, and I hear that a lot. And so because a lot of people with BPD are treated with antipsychotics, it then brings up the question, well, surely some kind of psychosis must be going on. Mm-hmm. But again, for me, like my therapist was telling me, the antipsychotics really help ease the paranoia, the severe anxiety. So I constantly thought, like, I'd catastrophize and think bad things are going to happen to my family. And the antipsychotics stopped that. So,
yeah, it's interesting. we wonder about the paranoid, that's the 9th symptom criterion, paranoid ideation, dissociation, severe dissociation of borderline. And I think that paranoia comes from that fear of abandonment. I think, just like the grandiose sense of self-importance is a driver for a lot of the symptoms of narcissism, the fear of abandonment is a driver for a lot of the symptoms of borderline. When I think of psychosis, I think of it's more of an internal process that doesn't have necessarily to do with fear. Like the paranoia is there because of progression of an illness like schizophrenia, or because of the depths of depression or the highs of mania. So I think it takes on a different element. But yeah, again, I do see why they get confused a lot. And of course, sometimes we do see an overlap, and then, somebody could be diagnosed, of course, with both. Many disorders, the comorbidity is fairly common with borderline. So that brings me to the last question here. And this episode is about comorbidity, but we threw this question in, we talked about this before, and we kind of liked this question and wanted to get it in here. And in some ways, I guess you could relate it to comorbidity. What are some of the advantages and abilities with borderline personality disorder? Now, the question also talks about disadvantages and challenges, but we've covered those pretty well. So what are some of the advantages and abilities we would see with borderline personality disorder?
Well, like I've done a video before on the positives of BPD, and there are positives to having this disorder, but unfortunately the negatives often outweigh them, so they just don't get noticed. But one would be intuition. We can walk into a room, start talking to someone, and we can pick up on their feelings very easily. We know if something's not right, if someone's feeling a bit down. And often if we say, "Are you all right?" then they'll open up and they say, "How did you know? I didn't say anything." So I'd say intuitive, being able to empathize. We're so empathetic. And maybe it's because we've been through what we've been through, but we can really empathize with other people. I believe we can, believe it or not, be good parents. And I think this is important for me as a mum of 4. We can, but all these positives, although like the empathy and the intuition might be there when the BPD is out of control, I would say if we really want to kind of develop those positives, we have to get into recovery, especially like being a good parent. If we want to be, we need recovery behind us, and then that can happen if we don't bother doing anything to get rid of the negative traits. They will always outweigh the positive. If we overcome and get hold of the BPD, get into recovery, we can lessen the negative traits, and really the positive ones can grow. And just like our negative feelings are really awful, so are our positives. So we have an amazing ability to love, to be happy, to get excited. Like we can get excited like a little child at Christmas opening presents. But the negatives usually cover that all up. Once we get into recovery, those positives can shine through.
Yeah, we talked about this one before recording as well, this question, as I mentioned. And, with borderline personality disorder, there are a lot of negatives. So you look at the symptom criteria and they're all negative, right? They're all,
of course.
Yeah, they're not really conceptualized as abilities or differences as much as symptoms that need to be addressed or people would want to be addressed. But having said that, sure, I think there are some advantages and abilities that only somebody with borderline personality disorder, or that might be more common with somebody with a disorder. The one I think of, I have a couple, but one is the high openness to experience. So the openness to experience is one of the big 5 traits in the 5-factor model. And with high openness to experience, and you touched on this, comes an ability to experience emotions intensely. And of course that can work against you too, but it can be a positive when the emotion is positive, somebody's extroverted. Also, we see increased fantasy, creativity, imagination on that same trait. So those are all positives. Usually we think high openness to experience has a lot of advantages over low openness to experience. And then the other one I touched on, we were talking about before, is if you think about some experiences in life, book learning, talking to people that have it, kind of falls short, right? Like, so if you take an example of like a combat veteran, you can watch war movies, you can read military history, but somebody really wouldn't know what it's like to be in combat unless they were in combat. Like, I can't relate to a combat veteran in a way that a combat veteran could, because I've never experienced it. I've never experienced that threat. And they have. So they have something, they have an experience that I can't have and wouldn't want to have, of course, because it's a terrible experience. But it does give them that perspective that somebody like me could never get. And I think you could apply the same logic to borderline personality disorder. There is something about having the disorder that gives you a perspective that somebody like me could never have. So you can relate to people who've had the disorder and be empathetic in a way that I couldn't be, and other clinicians couldn't be if they didn't have the disorder, because of that experience. So it's an advantage in the sense, if you want through your recovery to help others, it's something that you could definitely view as an advantage and an ability.
I was just going to say that, actually. Like, if you look at the 12 steps of Alcoholics Anonymous or Narcotics Anonymous, it's one alcoholic helping another, one addict helping another. And I believe the same can be true of people with BPD, one person with BPD helping another. And the wonderful thing, like with the 12 steps, is although you imagine that the addict that's helping that one is this one that's being helped, it actually helps both, like 50-50. And so for someone like myself with BPD, that's why I set up my channel, and I thought I wanted to help. It helps me as much as it helps other people. And I think that the same could be with anyone with BPD.
Yeah, it's therapeutic to empathize and to try to help other people stay in recovery or manage the recovery. Absolutely. So, yeah, so there are some advantages and abilities to borderline personality disorder as well. So that will be the last question. That's the last question we had planned, and we're right at above 30 minutes here, so it kind of worked out well. Once again, I want to thank everybody for submitting questions. If you have any additional questions, please put them in a comment to this video. We're going to continue this series and again try to answer many questions about borderline personality disorder from our different perspectives. I want to thank Sharina, Recovery Mum, for being on again today. Any words as we part?
No, I hope everyone had a very Merry Christmas and a Happy New Year.
Absolutely. Yep. Happy holidays. We will, as I said, continue working on different episodes, and we'll see you soon.